One of the things we found across different types of programs, different types of populations, that there is 4 keys to implementation that are common amongst all implementations that you see that are going smoothly. And so we've distilled it for people that we work with into these 4 C's, that we make sure people understand that if you're missing one of these, you're likely not going to see the success of measurement-based care that you're hoping for. So consistent refers to frequency for the most part. So that it's more often, let's say you're working in a pre-post model and that's the sort of measurement you've done in the past. I think people can hear about measurement-based care and think it's another measurement or reporting exercise. And I think it's quite opposite of what we're used to, where pre-post, as an example, if you're going that route, isn't providing much clinical value to the clinician or the client, because it's very hard to tie what changed when someone came into care and the change at the end. If that's 6 months in between, there are so many factors that can affect that. So consistency of measure is really important, because in measurement-based care, you essentially flip that model on its head, where measurement-based care becomes about, first and foremost, providing clinical value. And in order to provide clinical value, we need to be able to get curious and understand why something has changed. In order to do that, frequency is really important. So we often recommend every 2 weeks or so, but it really is dependent on the program, the number of sessions, the type of population, and that sort of thing. But most assessments that you choose to use will come with a recommended frequency. You may take that recommendation or change it, again, based on the type of program you're offering. But what's really important is that the client and clinician are able to stop for a second and say, hey, I noticed that you're much more irritable from a data perspective that you've reported than you were 2 weeks ago. What's changed in life? Do you feel like that? And get curious about it. In order to do that, frequency is really important, and consistently doing that is key. The second is customized. And so what it says up there around presenting issues, symptoms, and goals of the client is really important. And so the idea there is that while a clinic may have a set number of assessments or a set few assessments going to be applied to every person within that program, let's say it's an anxiety program, and you're across the board using the PHQ-9, GAD-7, and WSAS. And that's going to go to every single person that comes into that service. It's really important for the clinician to have the ability to customize assessments based on the presenting concerns of the person they're working with. So maybe someone within that program also happens to have disordered eating or struggle with an eating disorder. So you may want to add on an eating disorder assessment, because it's going to allow you to customize care to that person's needs and challenges and help improve the therapeutic alliance and understanding of each other. Being able to dive into what is actually of concern for them and centering care around what they're struggling with is vitally important. There's a really great example, the IAPT program, or NHS Talking Therapies program in the UK, which is the largest data set of measurement-based care, and it's across the entire country, where they've looked at those clinicians that haven't customized assessments, they've just used the standard measures, and those that have, and there's quite a big gap. I believe it's approximately 20% of symptom improvement increase on those that customize measures and then use those to talk to their clients. The third that we'll jump into is client visibility. And I would argue, and I think some of the research out there shows as well, that just as, if not more important than clinician visibility, is that the client can see their results as well. And in what we have said already, I think it's pretty easy to understand why, that if you're trying to create a discussion and the ability for that client to engage in care, ask questions, advocate for themselves, make sure their goals are being met, it's really important that they can see their change over time. And they can start to reflect on their goals in care, share what they're looking for, understand that the anxiety has increased, or the example I gave before around irritability, and maybe their data actually doesn't reflect, for whatever reason, what they're feeling. And that's a conversation they want to have with their clinician. But they should be a part of that process. And in order to do that, client visibility plays a really large role. And the fourth is collaborative. And I think you probably get this point from all the other statements we're making. But making the process part comes with number 4, which is if the clinician has visibility into outcomes and the client has visibility into outcomes, it's very important that in that session that you talk about the data that you're seeing and use it to inform care discussions, to inform treatment decisions, care goals, but that collaboration with the client and the clinician is vitally important, also plays a big impact on the therapeutic alliance side of things. But if you're not doing that, you lose the process of measurement-based care, and the process is where the magic is found, the actual impact that you can have on the quality of care that the client is receiving.